This video provides information that you should know before considering BRCA genetic testing. Who should consider having a BRCA genetic test? First, it is recommended for people with high-risk HBOC, such as those who develop breast cancer under 45 years, and those who have at least one third-degree relative who has been diagnosed with breast or ovarian cancer. Patients who have ovarian, fallopian tube, or peritoneal cancer, as well as male patients with breast cancer, should also be considered for this test. Second, when used to determine whether specific therapeutic drugs, PARP inhibitor, should be administered, this testing is recommended for patients with primary ovarian cancer, primary HER2-negative breast cancer, recurrent breast cancer, prostate cancer with distant metastases that cannot be treated with hormone therapy, and patients with unresectable pancreatic cancer. Your doctor will determine whether the testing is indicated in your case after taking into account your specific conditions. BRCA genetic testing examines two genes, BRCA1 and BRCA2. Our bodies are made up of many cells. In each cell, there is a space called the nucleus, which contains the chromosomes. And each cell contains genes, often described as the blueprint of our body. BRCA1 proteins are made from the BRCA1 gene, and BRCA2 proteins are made from the BRCA2 gene. Genes are constantly being damaged by UV light, chemical stimuli, and so on. Because BRCA proteins are responsible for repairing cellular damage, a person born with a pathological variant in one of the BRCA genes can easily develop breast and ovarian cancer, as the damage accumulates without efficient repair. If you have a pathogenic variant in one BRCA gene, you receive a diagnosis of HBOC. This would increase the risk of developing breast cancer, ovarian cancer, prostate cancer, and pancreatic cancer. In Japan, the percentage of HBOC is reported to be 4% of breast cancer, 10 to 15% for ovarian cancer, 3.4% for pancreatic cancer, and 1.1% for prostate cancer. So, how much more likely are you to develop HBOC-related cancer if you have a pathogenic variant in one of the BRCA genes? The incidence of breast cancer in women with HBOC is about 70% during their lifetime. Then, the incidence of ovarian cancer is 40% of those with a BRCA1 pathogenic variant and 20% of those with a BRCA2 pathogenic variant. In the case of prostate cancer, about 30% of those with a BRCA1 pathogenic variant and 60% of those with a BRCA2 pathogenic variant will develop prostate cancer. About 2% of males with a BRCA1 pathogenic variant and about 8% of those with a BRCA2 pathogenic variant will develop breast cancer. About 5% of those with HBOC will develop pancreatic cancer. Thus, Having a pathogenic variant in BRCA increases the risk of developing cancer, but this does not mean that someone with a BRCA pathogenic variant will definitely develop cancer. The result of BRCA genetic testing is considered positive when a pathogenic variant is detected, and in this case, you are diagnosed of HBOC and you are indicated for PARP inhibitor. On the other side, the testing is considered negative if no pathogenic variant is found. In this case, the possibility of HBOC is almost ruled out, and PARP inhibitors are not indicated. In addition, there are cases in which a variant is detected, but whether it causes cancer or not is presently unknown. In this case, PARP inhibitors are not indicated, and your follow-up strategy will be decided taking into account your medical history and that of your family. What medical management is recommended after you are diagnosed with HBOC? For females with HBOC, an annual breast MRI is recommended in addition to the other tests starting at the age of 25. In the case of ovarian cancer, there is no effective method of screening, and resection of ovaries and fallopian tubes is the only method to prevent cancer in these organs. For females who wish to preserve their fertility or hesitate to the resection of unaffected ovaries, transvaginal ultrasound and blood tests for tumor markers can be used to monitor the condition of the ovaries. However, these are not effective screening methods for early detection of ovarian cancer. They can only confirm the current state of the ovaries. For males, self-examination of the breast starting at the age of 35 and a blood test for the prostate cancer tumor marker called PSA after the age of 40 are recommended. As for pancreatic cancer, no effective screening method has been established yet. Next, we will discuss the inheritance of HBOC. Each gene is inherited from your mother and father, so you have a set of the genes. For example, a pathogenic variant in one of the two BRCA1 genes will cause HBOC. The probability that the gene with a pathogenic variant will be passed on to your child is 50%, regardless of sex. This form of inheritance is called autosomal dominant. BRCA genes with a pathogenic variant are usually inherited from one of the parents, so for siblings, there is a 50% chance that each sibling will have the same pathogenic variant. This table summarizes the advantages and disadvantages of taking the BRCA genetic testing. When the result turns out to be positive, one benefit is that the diagnosis of HBOC is confirmed, and this information can be used to manage future healthcare for you and your family. Also, PARP inhibitors are added as a therapeutic option. On the other hand, finding out about an inheritable disease may cause emotional stress for you and your family members and may bring disadvantages. In addition, you might worry about how to talk to your family about this. Next, in the case of a negative result, the main advantage is that the possibility of HBOC is significantly low, which will allow you to feel relieved. However, PARP inhibitors cannot be used, and hereditary cancer cannot be completely denied in this case because there are many other genes associated with hereditary cancer. Finally, there is also the option of not taking the test right now. The advantage is that, since you do not know the result, you do not need to worry about disclosing it to your family members. However, the disadvantage is that you may have less information to make decisions when considering your health management. The advantages and disadvantages of the test depend on each person. Let's think about pros and cons in your situation. The timing of taking the test depends on your purpose and your values. For those considering testing for the purpose of diagnosing HBOC, the best time is when you want to find out the exact diagnosis. If you are about to undergo breast cancer surgery, the results of this test will help you make decisions about the surgical procedure. However, it may be difficult to consider taking the test with a clear mind before surgery. In that case, you might consider taking the test after surgery. On the other hand, when deciding about the usage of PARP inhibitors, it is recommended to take the test as early as possible, as it will affect your future treatment plan. In this video, we have explained what you should know when considering BRCA genetic testing. If you have any questions or concerns, please do not hesitate to talk to a certified genetic counselor or your physician.